Does intermittent fasting cause cardiovascular disease and death? I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. In this video, we're going to go over that massively popular headline that said intermittent fasting causes heart disease. Be sure to stay to the end of the video when you hear my final thoughts. The video I'm going to review is actually a video that already reviews the article or the headline or the title. And as you'll see, this reviewer is pretty critical, as I will be as well. The video I'm going to review is done by Dr. Boz, B-O-Z. And if you don't know Dr. Annette Bosworth, that's her real name, goes by Dr. Boz online. She's an internist who has legitimate background in using low-carb keto diets in a clinical practice, and also has her kind of version of doing things. But she has background in looking at studies and did a really good job on this one. Let's see what she says.
8-hour time-restricted eating linked to a 91% increased risk of cardiovascular death? What the heck? Yeah, over the last 24 hours, I've had more people text me about what I think about this headline, because I'm actually really careful not to say the word study, because, yeah, I'll show you why I'm so suspicious. Here's a couple of the highlights. Yes, over 20,000 people in this study, I'm going to do air quotes, and those who follow an 8-hour time-restricted eating schedule, a type of intermittent fasting, have a 91% higher risk of death from cardiovascular disease. Yeah, the part that really makes me irritated was this conclusion. It says, even though this type of diet has been popular due to its potential short-term benefits, our research clearly shows that compared with typical eating ranges of 12 to 16 hours per day, the shorter eating duration was not associated with living longer. Okay, let's break this down, because that's ridiculous. Okay.
That's ridiculous. I like that. She doesn't hold back. Well, you know, the first thing, if you're my patient, I ignored this title. I ignored this news thing because it really wasn't a published paper. And so if you're my patient, you don't need to go any further. I would dismiss this out of hand. But because Dr. Boz is, I think, trying to show that she can review articles, and this one really isn't worthy of review, but we'll see why. But I suppose this will give you a little more tools in your critique arsenal, if you will. But the first thing is be skeptical of any news article, and then second, if it's just a meeting presentation, unless it's a series of randomized trials or some sort of solid newsworthy item, just because it's in the news doesn't mean it's newsworthy. And Dr. Boz actually tracked down the poster, which is great. That took a lot of work, I'm sure. And so let's see what the poster said, because again, this was a research presentation. At meetings, often there's a poster session. Academic meetings, research meetings have oral presentations. Those are usually the more how should I say, research that's more interesting, more well done, gets the oral presentations. So if it's a poster presentation, even at a national or international meeting, it's been vetted by the conference to be actually not an oral presentation, but a poster presentation. So even within that group of scientists who are reviewing it, they relegate it to a lower level of importance. So here's the poster.
Okay, let's begin by pointing out that this is not a peer-reviewed article in a journal. This is a poster. And poster presentations do have a very important part of the conversation in the scientific process. It is the beginning of a conversation. It is not a conclusive answer. It is the beginning of a conversation. All right, let's take a look at this study. That method they used were, over the course of about 15 years, they surveyed over 43,000 people. They excluded folks who couldn't recall what their eating window had been the previous days. They also excluded people who had either a very low or high calorie intake, and they outlined that with 800 to 8,000 for men and 600 or greater than 6,000 for women. They then said, yeah, if you have an unusual diet, now I wonder if that meant Is this not usually how you eat? Or does that mean that I'm on like a ketogenic diet? Is that what they mean by unusual? It does not say. The final part that they excluded is if you couldn't find the follow-up information on them.
So great points. And so you're whittling away. You go from 43,000 people. Now I should comment, this is a national database that anyone can get the permission to, well, anyone with the skills to survey analysis can get this information. And they started with 43,000, and this is called the NHANES for short. NHANES, and they ended up with 20,000. So they're already half of the sample has been excluded for whatever reason. Now in the classic epidemiology teaching, if there is no systematic bias, and you still have a finding, it's worth seeing the finding. But here, what she's saying is there may be systematic bias in excluding people, so that if someone's doing a low-carb or carnivore diet and time-restricted, they would be thrown out. Let's say they were healthy, they'd be thrown out, so you'd be focusing on people who weren't doing a healthy version of a time-delimited eating or window of time. And so these are all important things, but I wouldn't have even gone this far. Remember, I would have stopped, okay, it's a poster at a meeting, let's wait till a paper comes out. This is not really newsworthy, but we're not in charge of the news, right? So anyway, let's keep slogging through this one.
So they reached out to these 20,000 people and said, over the last 2 days, what time frame did you eat? Looking at those who kept their eating window 8 hours or less, 8 to 10 hours, 12 hours, and then up over 16 hours. Once they had that data, they now said, let's check with the registration of death in 2019, at the end of the year of 2019, to see if these people died. And if so, what did the registry say they died from?
And, you know, this is a flaw of pretty much all of these epidemiology studies that look at diet. I think it was the Nina Teicholz who called out one of the early diet studies. The study was done during Lent, and so in that area there was a lot of eating change during the period of time they did this study. So anyway, the idea here was, let's see if someone recalls that they only eat during a certain time window, if that's associated with earlier death, an earlier heart attack, death, that sort of thing.
Let's take a closer look at this data. First of all, they're showing you that, yes, the people that were less than 8 hours, these are their average ages, and they're using the 12 to 16 hour group as the reference. This is the comparison group.
So just if you're not familiar with the intermittent fasting time windows sort of thing, 12 to 16 hour window means you've eaten through that usual like 8 a.m. through 8 p.m. time of day, like quote, normal people who eat 3 meals a day. If you're going to limit yourself to 1 meal a day, that's actually 24-hour fasting, because you're only eating once a day. Your time window might be just a few hours. Well, here the lowest time window was less than 8 hours, which I suppose could mean from 8 a.m. to 4 p.m. or from noon to 8 a.m. That's what that eating duration or time window means. So the reference range of, quote, normal was 12 to 16 hours, meaning you ate from 7 a.m. to 11 p.m., something like that, which that seems like a lot to me. But anyway, a lot of carb eaters in the study for sure, which again is not in the examination of this information at all.
When you look at those that ate less than 8 hours a day, 27% of them were current smokers, as compared to nearly 17% of the reference range. First of all, that's a huge discrepancy and has a very clear link to one of the biggest risk factors for causing heart disease. So let's take a closer look at this all-cause mortality. First of all, we're going to notice that none of the p-values are the 0.05 that is standard for being confident in the information. This hazard ratio also, keep in mind, when the longer a line, the less likely we are to be confident in it. That's what this confidence interval is really looking at. when the line crosses the reference range, you should be very suspicious of whether or not this information is worthy of making headlines like this.
Well, and good points. I don't think it's headline worthy, not because of the statistics, but because of the type of study it was. It's an observational study, and it's a poster presentation. That's not worthy of headlines. But here, just a little nuance for the extra statistician types. The p-value is interesting. You hear debates about the statisticians. You take p-values or you take confidence limits or you do both. And really a p-value or a confidence limit is just trying to give you an idea of how certain you are of the result. It's a matter of the number of people in the study, the outcome that you've had, how close, how tight the information is. And so a p-value of 0.05 is sort of the first pass of education in statistics for doctors. But really, it's more complicated than that. If you're looking at one thing, we kind of all sort of say, well, a p-value of 0.05 is is like the convention. And the lower the p-value, the more certain you are. Well, if you're looking at 20 different things, you really ought to adjust the p-value divided by 20. Or if you're looking at 100 things, so here we're basically taking a pot shot of a study. If they had a priori one thing to look at, then 0.05 would be reasonable. But if they're just looking at 20 different things, then they really ought to adjust the 0.05 by 20. And this is just by convention to me. So it's harder to prove statistical significance if you're looking at 100 things, which makes sense because randomly you could look at a lot of things and some could be statistically significant just by randomness, not because it's a real signal. So, but that was pretty well done. So if the line crosses the 1, then it's not statistically significant. And here you can see the points in the middle. If the bars go across 1, the p-value is nowhere near 0.05 or 0.01 or 0.001, which really probably should be the criterion here because they're looking at so many different things.
So what their data says is if you had the eating window of less than 8 hours, you were 26% more likely to die of all-cause mortality, as much as the 26%.
So before we leave that 26%, let's look at it. So this is a kind of a similarity to the relative risk versus absolute risk issue, where you're looking at outcome study and they say the risk went down 50%, but it really just went from 2% to 1%. 50% is the relative risk reduction. I mean, 1% is half of 2%. It's not a lie. It's just a stretching of the perception of how important it is. But if you go from 2% to 1%, it's really a 1% absolute risk reduction. So let's look here at the top where the hazard ratio is 1.26. So technically you can say that 26%, that it's a 26% higher rate. But you have to look, that would be the relative risk comparison, but you have to look at the actual number of 1.26. So 1.26 is in the world of epidemiology is very, very low. And so there would be like looking at a 2% to 1% change in absolute risks. For a hazard ratio or relative risk or an observational study, you want that ratio to be 3, 4, 10. For smoking, it was 5 to 10 fold, not 1.25 or 1.5, it was 5.0, which was the risk of having lung cancer for smokers compared to smokers. So here, even if it was a 20% increased risk, it's a yawner. It went from 1 to 1.26, which is still within kind of and it's not even statistically significant. So the absolute risk and relative risk should always be considered when you're looking at information. Same here, you need to see the relative risk, 26% increase, and then the hazard ratio, or 1.26. So it's not like a 1 to 2 or a 2 to 4 sort of change.
increased death would have been a sensational headline. No. They use this one. They use the cardiovascular data to say that if you had an eating window of less than 8 hours, you were 91% more likely to die of heart disease. They were good enough to say that yes, this p-value is in the right range to be confident in the math. But let's not skip the flaw that they asked them one time, what did you eat over the last 2 days? And then based on that data, we're going to look at your death some 8 to 13 years from now and conclude that the reason you died was because of that eating window that you had the 2 days prior to asking you that question. If you were one of the people sharing this headline with everyone.
Yeah, excellent point. And looking at 1.91, 91% increase, again, it's from 1 to 1.91. It's not from 2 to 3 or 2 to 4. So always look at the numbers where you're the absolute and the relative risk. But here it's even sketchier because the event numbers, so the second column from the left, the less than 8 hour window, so you're eating only at a certain time of day, like noon to 8. The event rate was 31. So normally the confidence limit will give you the idea that 31 is a very, how should I say, an uncertain number. And here, though the p-value and the confidence limit is low, that's because they're divided by the 414 people, but you have to remember we started with 40,000 people. And the 40,000 people were whittled down by various reasons down to 20,000 people. And if there were biases introduced here, which known or unknown, the smoking is a big one here, difference in smoking, a macronutrient composition analysis would have been nice as well. But again, we're stretching the very weak data here, and that there were only 31 people in that group who died over that period of time of cardiovascular mortality. This is, again, making a mountain out of a molehill. It's not even a molehill. I absolutely agree. So thank you, Dr. Boz, for an enlightening, detailed analysis of a poster presentation at a meeting that I didn't even want to go into, but because my patients were asking about it, yes, it's been looked at, and let's wait for the paper to see if it's coming out. And I should say the idea of a poster presentation is just very, very preliminary. You do pass through, in most meetings, some sort of vetting process. You can't just send any poster to a meeting. But the rate at which, the percentage that are accepted, it varies by meeting. And if it's a hot topic like this, whether the data are any good, it might be accepted as a poster with the idea that it'll be picked up by the media and then get attention to the conference and that group of people. But really, this was not newsworthy. And even at the end of the day, if it is published, association does not mean causation. Repeat that after me. Association does not mean causation. And the NHANES data, in order to look at what people are eating, is pretty weak information. I hope that's helpful. If you like, be sure to like, subscribe, and ring the notification bell to get further content. We're dropping new videos on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.